I'm happy to introduce our Director of Diversity, Equity, and Inclusion, Kim Kaiser.
This is like layers of an onion. There are so many intersections that go on here. The intersection that is near and dear to me is that impact on the Black and Brown, Latino, African American, Black, and Indigenous communities that were suffering at the time when COVID hit. This is like a battlefield, and we're waging a battle where the soldiers were wounded when the Army came in, and the Army was COVID. And at the time, we had individuals who were suffering at the intersection of historical trauma, adverse childhood experiences, their environment, living in a world where the zip code dictates what services are available to you, to our children and our families, within all systems. For the families that we are trying to help and the individuals we are trying to help, these are people who do not have those resources. They don't have the efficacy. And a lot of times they don't even know they have the voice or the choice to fight. And that's another reason why we're all here. So when we look at all of the issues that we're facing today, we're talking about a garden. We are planting seeds for the future in the work that we do. Just like Ed said, this is hard work. We don't get paid a lot of money. If we ever wanted to get rich, this would not be the career to turn to. So we all know that our hearts and souls are dedicated to this work. But at the same time, we have to understand that the individuals that are charged with the responsibility of planting seeds of efficacy, of building resilience, coping skills, to guarantee a better future for individuals, youth, and families in our community, they deserve to have a living wage. They deserve to have adequate training. They deserve to have a level of workforce development that helps them to rise to the top tier levels in this field and continue to pull others up to do this work. Professions like mine within peer support, individuals with lived experience, this is also underpaid work. This is work where we are preventing the entry of individuals into treatment, into residential. We're working to develop skills within the community in a strength-based, person and family and culturally centered way. This is for all of society. So when we talk about the groups of individuals who are suffering the most in all of our communities, those individuals living in intergenerational poverty, those individuals living with intergenerational trauma and historical trauma, we don't do anybody any kind of service. We do a disservice to this entire country when we say that the lowest paid groups of people are going to be responsible for helping to improve the lives of children and families in the communities where we all live in. So this is why I think that this is a move that we have to fight for. We have to continue to fight for, because this is for our future. And lastly, I just want to say that I talk to children every week. I talk to families every week who have been impacted. The vast majority of children who are waking up every morning and in new levels of poverty and having lost a caregiver are astronomical. So not only do we have individuals impacted by this trauma who already had pre-existing behavioral health conditions, we've got new people being added to that list. We've got new families, children, higher rates of suicides. We already spoke about the overdoses, and it's going to keep coming. And it is a tsunami.